Indeed. Yes, we've got a little bit later on, we're going to be talking about STBs, but in this panel we're going to focus on a certain number of areas, and I'd like to ask the first panel up to the stage to join me while I introduce you all and do have a think about the questions you might like to ask in these particular areas: mental health, cancer, urgent and emergency care, and people with learning disabilities. So let me introduce our panel. Obviously Simon Stevens is still with us, can answer over a broad range of issues. Professor Tim Kendall is the National Clinical Director for Mental Health for NHS England. Callie Palmer is the Chief Executive of the Royal Marsden NHS Foundation Trust and NHS National Cancer Director for NHS England, sitting here. Pauline Phillips at the far end is the Chief Executive of Luton and Dunstable University College and National and Urgency Director. Sorry, that's you. Sorry, that's, yeah, I'm getting confused, sorry. So Pauline Phillips there is the National Urgent and Emergency Care Director for NHS England. And at the far end, I've written a big note saying rainbow dress, so I should have got that right. Professor Jane Cummings, Chief Nursing Officer for England. So I hope that's all clear for you, first of all. And I wanted to begin, first of all, with Callie Palmer and on cancer, because a big announcement for you today in terms of upgrading some of your equipment. Tell us a little bit about that.
Yes, thank you very much, Martha. Can you hear me all right? Yes. So I'm absolutely delighted to say that today an announcement's been made to make an investment of 130 million over the next 2 years in upgrading radiotherapy equipment throughout England. The Cancer Task Force in 2015 gave us a very clear roadmap of the journey, if you like, in cancer to improve patient experience and improve survival. And part of that, of course, is making sure we've got a really modern service, both in terms of workforce and kit. So an announcement that you may have heard already today, so £130 million over 2 years, so that we can make sure all patients have access to the best precision radiotherapy countrywide. So that's today's announcement. And then alongside that, we're publishing our annual progress report on the work we've been doing over the last 12 months to improve the speed, efficiency and experience for patients coming into the system to have their cancer diagnosed and treated. That report's just being published, and it covers about 15 highlights for those who don't want to read the full thing, just explaining the work we're doing in both prevention, early diagnosis, modern treatment, and supporting patients living with and beyond cancer, which is just as important.
Is it fair to say that Britain does lag behind in some areas when it comes to cancer survival rates?
The data show different performance by different tumour types, but the key, I think, that we feel is that it's very important that we improve public information so people know what to look for, signs and symptoms, and very importantly that with my team and with colleagues throughout the health service, we can introduce better, faster diagnosis for patients. It's making sure that we see patients at an early stage when we can make the most difference to their survival and also their experience of care.
Thank you very much indeed. And we'll turn now to another very important area of NHS England, and that, of course, is mental health. And you know, sometimes described as the Cinderella service, isn't it? The overlooked service of the NHS, at least it has in the past. And what in particular are you doing for young people with mental health problems? Because that's received quite high salience in recent years.
I think in particular I'd like to focus on what we're doing for young people with severe mental health problems. We're investing in developing early intervention services, which will give people pretty rapid access. I mean, at the moment, I think people do, or have, up until recently, waited very long periods of time to get good treatments. Now, we're probably 50% are getting seen within 2 weeks of referral, and really good quality treatment started. So they're getting
that early intervention is incredibly important, isn't it?
Incredibly important. It's about one of the best predictors for the long-term outcome for people with schizophrenia is how long that period is. The longer it is, the worse the outcome. So getting help quickly, and it's getting the full range of help. So talking therapies, some drug therapies where needed, help for the family, help to get them into work. So.
Yeah, I know this is an area we've covered a lot on my radio programme,
yes.
And I was really shocked to find out about the particularly high suicide rates amongst young men.
No, it's true. I mean, I think the suicide rate is another area that we're wanting to address. A lot of that is expanding access to mental health services. About 70% of suicides are in people who are not in mental health services. So although we've done well in bringing the suicide rate down within mental health services, we've now got to extend access, and that's what a lot of the programme is about.
Okay, well, I'd like to move on now to Pauline Phillips, who's a National Urgent and Emergency Care Director. And we've heard from Simon Stevens about some of the financial pressures that there are on the NHS. How does it particularly affect your area?
Well, I think the first thing to begin by saying, and I think Simon did highlight it earlier, is that at the moment 9 out of 10 people, when they access urgent and emergency care, get seen in our emergency departments. And it's not just seen, they actually have a diagnosis and treatment started within 4 hours. And I think that's a pretty significant achievement and compares very well to what happens in Western Europe. But I think what a lot of people don't understand is that at the same time we have over 30,000 patients every day contacting our 111 services. They get a response within 90 seconds when they make the phone call. Within 60 seconds when they make the phone call, and only less than 20% of those patients actually end up in our hospital system.
Because
so we are not doing badly.
Because of the 111 service, they were actually driving more people because of the algorithms.
No, less than 20%
yeah.
actually. So we're doing pretty well at the moment, but clearly we are aware of increasing demand, and the whole strategy that has been set out, which has had extensive public and professional engagement, is about creating a system whereby if you do need urgent care, you can make a single phone call and get directed to the right place. And if you need real emergency care, that you will get taken to the right department promptly.
And with how much trepidation do you face the winter? I mean, we're used to this at the headlines, NHS winter crisis.
Yes. Well, I think, first of all, to acknowledge that the strategy has been set out. We are now in the implementation stage of the strategy, but we accept that we won't be able to wave a magic wand and deliver the strategy within a number of months. So what we have done nationally is we have also developed an A&E improvement plan for this year and a very robust winter plan. And both of them were launched in September, and we have been working on them since then. So I think early preparation is key, but it's not just early preparation, it's having a national grip of the situation. And on a weekly basis, we are monitoring from a national level down to a local level the preparedness and the actual performance that's taking place. So there's a lot of transparency in the system, so as we know where to intervene and where to support.
Thank you very much. I'd like to move on to Jane Cummings now, and I know we want to focus on care for people with learning disabilities, and a year on from an important report, Building the Right Support, and you were looking at how to avoid so many people with learning disabilities ending up in big hospitals a long way from home. I'm sure many of us will have seen the horrific Panorama programme about Winterbourne View a few years back.
That's right. So we did publish it about almost a year ago, actually, at the end of October. And we are beginning to make some now significant progress. It is difficult, and it's a whole system programme. It's not just the NHS. We need to do this in collaboration with lots of, with other organisations. But we are seeing a reduction in the number of patients that are in hospital. We've had a 9% reduction since March of last year. We're also seeing month-on-month.
So that's
now.
a percentage, but how many people are still being seen in hospitals, would you say?
We've got about just over 2,500 people that are in hospital at the moment. There are 1.2...
Which is a lot, isn't it?
It is a lot, yeah, absolutely. We've got about 1.2 million people with learning disability in England, and about 24,000 of those are at risk of admission. So what we've been focusing on through Building the Right Support is developing community services that are in place to stop people going into hospital, as well as being able to discharge them into appropriate services. And we are beginning to see, month on month, since January, less people being admitted than those are being discharged. And I think that's a really important shift and hasn't happened for a very long time.
And do you think that you have sufficient resources for that kind of community work, which is obviously very important in order to implement the strategy?
What we've said and what's important is that we look at the total resources. So we look at the resource that's associated with our specialised commissioning, so for people that are being admitted into secure accommodation, alongside the resource that CCGs are using to admit people and the resource that local authorities have got to support people in the community. And what we've recommended in building the right support, and we have started to see people doing this, is pooling those budgets and looking at what the needs of their population are and how that can be best managed. The other thing we are now beginning to see, and it's increasing, not fast enough yet, and we're still pushing for that to go faster, is an increasing number of community services being put in place, like crisis response teams, 24-hour access, and in some cases the ability to give people almost like a place of safety for a very short term to just diffuse the position, and that actually is beginning to now have quite a significant impact. We've got more to do. I'm not complacent at all, but we are beginning to see the shift in the right direction, and that's important.
Lovely, thank you very much. Well, I think a lot of territory covered there, but I'm sure you've got some questions. So we've got microphones here. Do put your hand up if you'd like to ask any questions to anybody here on the panel, or of course to the headman himself, Simon Stevens. Yes, so there's a gentleman there. If you just wait for the microphone to reach you. Thank you very much. Good to see some hands up. Often you get a kind of tumbleweed moment where nobody dares ask and they all ask their questions at the end, and then we'll come to this gentleman afterwards. Yeah.
Well, I'd like to address all the board, members of the board and the senior executives, but particularly Simon Stevens, because it's very apparent from what Simon said that you simply haven't got enough money. He told us the government are not going to give NHS England the amount you asked for, and it's pretty obvious, and I'm not going to go on and on, moderator, it's pretty obvious that in the proper sense of the word, our health service has reached a crisis. It's falling apart at the seams. So what my question, I've got a question.
Okay, yeah.
I want to know when the senior members of NHS England are going to publicly stand up to the government, as NHS providers have, and say, look, we haven't got enough money, you've got to give us more. And just to say you're just employed and all that on very high salaries is the Nuremberg defence. You've got to tell the government you haven't got enough.
Okay, tough question there. I think that's straight to Simon Stevens.
Yes, well, I think you'll find that I've been more outspoken on this topic than any of my predecessors. As I say, I came to our annual general meeting last year, a month before the spending review, and told some home truths about what that was looking like, and indeed have been very explicit with Parliament about what the NHS has and hasn't got, looking out over the next 5 years. Ultimately, in a democracy, in a tax-funded National Health Service, decisions about the NHS budget are set by our elected representatives rather than by the NHS itself. But you need not worry that we will not speak out about the benefits of continued investment in the National Health Service. We certainly will.
And I think it's only fair to ask some of the other members of the panel, have you got the money that you need in order to be able to have a truly successful cancer strategy?
Well, as I mentioned money, I should probably answer. So the NHS is an absolutely wonderful institution, but we can always do things better. So there are two things. There's the issue of negotiation, which Simon's talked about, but there's also a responsibility for all of us to use precious resources more wisely. And certainly in the area of cancer, it is quite clear that there are some improvements we can make. So some of it is about investment, like my earlier statement about radiotherapy machines, but some of it is stopping wasteful diagnostic tests and duplication. And I can see that in my local work at the Royal Marsden in London, that there are areas where we can save money and use those resources more wisely. So I think it's about doing both. I think that's really important. So certainly for the cancer programme, I'm very lucky that it's a national priority. So some of it's about heavy lifting and doing the transformational job. Some of it is about investment, and that investment's been made available. So I'm delighted to say that. But I also have to make sure that we're doing things wisely with those resources.
Do you think you should be speaking out more, telling the government you need more money, according to the gentleman here?
At this point in time, Adult mental health services are gradually working up so that they're eventually going to reach £1 billion extra per year by 2021. And that billion will allow us to see an extra 1 million people. And in children's mental health, there's about 1.4 billion that's being invested over the period of the next 4 years. Now, nobody says that that is enough, but we've got to start somewhere, and I think this is a really good place to start.
Okay, in the area of urgent care?
Yeah, I think the significant challenge as far as urgent and emergency care is concerned is not asking for more money, but it's creating the transformation to move resources from hospital settings into the community. And that's what the transformation agenda, the urgent and emergency care review, is about. And importantly, that's the work that is also being done through our STPs, which you will hear about later.
Will that solve the issues altogether, though? Because isn't there a recruitment problem? And wouldn't being able to offer more money, perhaps, to people in urgent care, wouldn't that help?
Yes, but I think some of the recruitment issues we are doing better. For a start, if you talk to the College of Emergency Medicine, they will be able to explain to you that this year all posts have been filled. So I think that that is desperately important. We're also creating very different types of roles for the future. So those recruitment strategies will meet the future needs of our population, and we need to move away from the more traditional roles. So I think for us, it's making smarter use of the resources that presently exist and are really spent in a traditional way.
And finally, in nursing care, I think one mic would do.
Well, I won't repeat a lot of what people have already said, because other than that, I would agree with it. But I think the issue for us around learning disability is not only are we improving the quality of care, we're also improving the quality of life. And so it's using the money we've got in the most effective way to actually do that. And for the vast majority of people, that is about having services in their own communities. And, for example, giving them the opportunity to work and to gain employment. And that is really important. Of course, there are problems. Simon mentioned social care earlier. That does have an impact in learning disability. But the issue is that we need to use the money we've got in the most appropriate way and actually make the best use of it. And we're not doing that in all cases at the moment. We are spending high amounts of money keeping people in hospital when they don't need to be there.
Okay, thank you very much. Yes, I think there's a lady there.
Good evening, panel. Laura Shutovich, representing Hereditary Angioedema UK. My patients often present in A&E with uncontrolled swelling, including laryngeal swelling, which can kill them. There is very good prophylactic treatment available, but we constantly get this when I try to point out that, well, we could actually save on A&E admissions by giving these patients their prophylaxis at home. We get the, that's not my budget, love. So I'm fascinated by Jane having said they were able to pool budgets. Why can't we get more pooling of budgets and resource sharing within the NHS?
Okay, thank you very much. So perhaps to Simon Stevens first of all, and then...
well, I think what's so kind of powerful about that point is it both kind of illustrates the answer to the prior question, and it sets us up for the discussion we're about to have, actually, because what you're about to hear from Amanda and Andrew and other colleagues is exactly how they're going to be pooling budgets across the country in order to be able to end that kind of patients being passed from pillar to post problem that you just described. So the good news, in a sense, is that those opportunities are in front of us. And if you think about the report that you might have seen yesterday as well from the Academy of Medical Royal Colleges, a whole list of areas where the NHS at the moment is either over-treating or inappropriately treating patients. This is the doctors' organisation saying, this isn't anybody else. I think the fact is that we can create headroom for the investments in the type of services we want to see over the next several years if we get these things right.
Which, Pauline, presumably the kind of thing that you'd welcome, because it sounds like there are people ending up in A&E and they needn't be there.
Yes, and fundamental to the urgent and emergency care review is setting up a system whereby when somebody has a need that they can contact 111 and not just speak to 111 or 999, etc., but to have the whole range of providers who are involved in the day-to-day care of a patient available, so as that we can access information about those patients and connect them up with the right service so as they don't need to come to A&E to receive the care.
Thank you very much. And it goes to the gentleman in the pink shirt who's been waiting very patiently.
Thank you. Brent McInerney, I just volunteer in the local community, really. The question I've got asked, would I like to ask, really, is around health and social inequalities. I mean, all the presentations so far, I think have implied that, but we haven't been explicit enough about it. And it's pretty much the same question I asked last year as well, really. And I'm just wondering, with the opportunities we've got, and I do see them as opportunities, not challenges, with a sustainable transformation plan, where we think that we're going to tackle these. We are going to come on to that in a second. Tackle these at its greatest, and how we're going to reach the most in need fastest. So if we look at, and this could be one for any of the panel, really, but I'd just like to ask Jane, really, with the great work she's done and led on learning disabilities, really, is maybe one or two examples, if we've got that, you know, tangible examples that we can share with people, not theoretical, just tangible.
Tangible, thank you.
Okay, thank you, Bren. Well, one of the examples I can give is that we know that if you look at the quality of care for people with learning disability, they don't access things like annual health checks, as well as people who haven't got a learning disability. So that means that things like screening for example, cancer doesn't happen, that their physical health doesn't get assessed and treated as quickly, and that is a clear inequality. So part of this programme, when I talked about improving quality of life and improving quality of care, is actually having access to things like annual health checks. And that's a really important thing. The other issue is that many people with learning disability die earlier than other members of the population. So we are implementing a learning disability mortality review, where we are looking at what lessons we can learn to actually reduce that and reduce the gap between those with a learning disability and those that haven't got it. So those are two really tangible examples where this programme is striving to improve care and reduce that inequality.
Thank you very much. I'm just going to take one more question now, and remember there will be time for questions at the end as well. So this gentleman here.
Kevin Armstrong from Pancreatic Cancer UK. You can probably guess what my question's about. The cancer strategy has a fantastic ambition to achieve a 75% survival rate after the first year, but the average survival rate for pancreatic and the other least survivable cancers is currently just 34%. Would NHS England consider taking a sort of focused approach to these cancers, which cover sort of more than half of all cancer deaths in the UK?
Yes, Callie. Yeah.
Thank you. So we're very aware that the cancer strategy talked about, the independent task force was thinking about rarer cancers and cancers where outcomes really haven't shifted enough over quite a long period of time. So one of the things that we're doing is making sure that while a lot of the work that we're doing is generic, so much better public information, earlier diagnosis, swift access to treatment and so on, and improving speed and quality, we do need to make absolutely certain that we're particularly targeting areas where we need to gain more traction faster. So we have a National Cancer Advisory Group, which is chaired by, as you probably know, by Sir Harpal Kumar of Cancer Research UK. And they are holding my feet to the flames to make sure that where patients do less well, either because it's a specific cancer like pancreatic cancer, or in terms of care of some of our older patients, or patients who are come from different ethnic backgrounds where they do less well overall, that we really target those appropriately over the years of the programme till 2020. So just to reassure you, we're very aware that it isn't just a generic programme of work. We need to do some targeting over the years to 2020 to try and shift that paradigm, shift the balance and improve survival for all patients.
Lovely, thank you very much indeed, and thank you to everybody on this panel. We're going to move on now, but I'm sure you'd like to show your appreciation for the answers that they've given us.